Hmm. Scott, businesses, including restaurants, reopen them. You say that as well. You also say, I didn't quote you, but you argue that we'll need to use some new measures for hygiene, social distancing, and so forth. Just elaborate on that for a sentence or two, would you please? Sure. How different does the working environment need to be to make it safe?
I think that we already, okay, no one knows the real answer to that, but we know, we are sensitized, we have learned a lot of things about hygiene, sensitivity to any kind of distancing and this sort of social behavior. No one knew what these words meant even before. And now I think as a society, we've learned quite a bit. And restaurants and private enterprise, as you undoubtedly would realize, they want to make an environment that their customers and their employees feel safe in. Otherwise, it's not going to function. So you don't read, and they are already responding. Certain businesses are putting in barriers, plastic barriers. Other things are being done with hygiene in restaurants and stores. But I think it's important to also recognize two things. Number one, guidelines are important. And I feel like educating the public, this is the role of government here. I could see requiring restaurants to put up a guideline on the door that says if you're over 65 and or if you are diabetic, there may be a risk for being in a small space with nearby other people. But that's very different from saying to a restaurant must have 6-foot spacing. A restaurant must have masks. And I think this is a very important topic. The science behind 6-foot spacing is embarrassingly weak. And one underscore to that is that the WHO itself recommends 3 feet. Many countries in the world use 3 feet. Some countries use 1.5 meters. These are obviously arbitrary pseudoscience kind of concepts. And okay, one of the studies that was done to necessitate masks in certain distances is they put 2 hamsters in cages. One of them had a mask on, one didn't, and they blew with a fan micro droplets at them from certain distances. This is not the same thing as an infectious agent causing an infection. Point number 2, though, we know that 99% of people that get the virus have no serious problem with the infection. Half are asymptomatic.
Repeat that percentage. I thought it was at least half. Half are asymptomatic.
Half are asymptomatic, and 98 or 99% have no serious illness from
so you might feel as though you have a cold, sniffles.
Well, or you have the flu, or it's a bad flu, and you stay home.
Right.
That doesn't mean that you're not going to go to the hospital, you're not going to die. And frankly, if you feel that it's risky to go into a restaurant, then don't go. If you're 75 and a diabetic with, heart disease and obese, and you're a high-risk person and you don't feel safe going into a restaurant, then don't go. No one's mandating anyone goes. But to set up a law or a restriction that is based on very, very weak science at best, and to say, okay, you must operate that way or you can't open your restaurant. Peter, 70 or 80% occupancy is meeting costs in Manhattan and in most places for restaurants. You can't have a functional business like that. And no one wants to even go in under those circumstances. The science is really not science. It's a fear-based and sort of cherry picking of certain studies. It's very poor analysis. As I say many times, a lot of smart people are doing a lot of sloppy thinking.
All right, then let me ask you about what we should have learned, or perhaps to some extent what we should have done. To return to the central point, which I have to say over again just to get it in my mind. It's just so shocking. The lockdown has already cost about twice as many years of life as the virus it was supposed to protect us against. This could only have happened if our public health officials and elected leaders made terrible mistakes. Name the top 2 mistakes. What you've already said, you can understand why Dr. Fauci thought what he thought and recommended what he recommended. You can understand the initial lockdown. They didn't have good data. The initial data coming out of China, or the initial indications coming out of China, looked very scary. But that was then, and here we are 3 months later. When should they have changed? What were the mistakes?
The big mistake, frankly, was relying on and reacting to continually the hypothetical projection models that were grossly wrong. This is still being done. I'm interviewed about this all the time. Wow, there's a new projection. The projection models now that are being used, you have to realize this is a very common sense point, I think. Every 4 to 5 days, they readjust the projection. Well, I mean, if a model, and this has been going on for 3 months now, if a model is good, why would you have to readjust it every 4 to 5 days? It's because there's new data. Why don't we just look at the data? So instead of focusing on the actual data that we've been acquiring here, they keep relying on these sort of projection, hypothetical, worst case scenario models. And those models, by the way, anticipate deaths based upon the rate, including the rates of nursing home and non-protection of the elderly. So the models themselves are grossly flawed, and we have that. This is sort of a societal problem here, I feel, and this is not sort of my area of expertise. I'm just this conjecture, but we're in a world of hyperbole. We're in a world where social media is an igniter of really outrageous statements and reactions and instantaneous things. And we're in a world where anyone who can do a Google search thinks they're an expert. So we hear a lot of people pontificating about medications, about side effects of medication. They don't have any medical perspective whatsoever. And the news is sensationalizing. One example was this idea that children get this rare entity called Kawasaki syndrome, where it's similar to that. This is extremely rare. And, but this was the headline for over a week, really. And the reality is that doctors understand that there are rare exceptions that are very dangerous in virtually every disease. The rare exceptions do not change the overwhelming amount of data. Yet that carried the day. So there's this sort of reactive fear that has entered into the public policy making.
Scott, let me read to you a quotation. This is George Gilder in the Wall Street Journal. This is taking you, I want to stipulate that I'm going to ask you a couple of questions now that aren't strictly medical, and if they make you feel uncomfortable, say so. But I know you study public health policy, so this is a question of the interplay between democracy and medical professionals.
Exactly.
All right, so here's George Gilder. The US economy has been cratered less by the coronavirus than by the response to it, driven by the undemocratic idea that science should rule. There are not and never will be scientific answers to all public problems. Politics is how we exercise our free will, and that rather than reflexively deferring to experts, we should defer as much as possible to the principles of freedom and common sense, close quote. What do you make of that?
Well, I think that's right on target, and that's sort of the difference between what I'm saying, which is have regulation guidelines, but that's different from sort of dictatorial confinement or conditions for selective businesses are essential and selective businesses are not. The whole thing is sort of off the rails in terms of what you thought was a free society. But I would modify something, and that is that this is the difference between what I do and sort of pure science, because public policy, healthcare policy, takes into account healthcare, but also public policy. And public policy, as you know, has a lot to do with what he sort of called politics, which is what is the way to guide society to implement the information. And what I've said and what I still say is that our leaders failed to have the capacity to sort of analyze in a logical, common sense way what the experts were saying. We should never and will never in any free society simply delegate to people who are computer modelers what we should do in a policy world.
All right, let me ask you, President Trump and many governors have been attacked again and again, very roundly, for failing to defer enough to the so-called experts. Excuse me, I shouldn't say so-called. They are experts, to the experts. But you're almost arguing that they deferred too much to the experts, that they failed to push back and say, wait a moment, my job as an elected leader is to make trade-offs. And it's my job to preserve the freedoms of this nation and to engage in a certain amount of common sense. And above all, if I possibly can, to preserve to the extent possible the economy, the functioning of our schools and our businesses. That's my job. So you're the expert. You give me advice. I make decisions. Is that what do you make of all that?
Well, I mean, I think this is exactly right. In other words, I like to say that empathy and caution are not enough from a public figure. We all know that this was a disaster. We all need the reassurance and the caution. But on the other hand, the way to really reassure the public, to me, is to say in a very logical, common sense way, what are the facts? And given all the facts and given what we're going to do, this is what we feel is the best pathway to come out at the other end. And I think people are reassured by listening to people who can logically present the information and make a logical case, because, okay, not everyone's a scientist or an epidemiologist or an infectious disease person. No one has out there in politics, hardly any have really had medical training, some have. But the reality is that people understand logic. When you have the facts and then you have people give you the facts and then you use your common sense, because, and frankly, this has been missing on the other hand of this from the experts. These people have been sort of talking about their own fields, but they have not used deductive reasoning and common sense and logic to interpret those findings for political leaders and for public policy implementation. So there's been a disconnect.
You have a high opinion of the American people. Give them the facts and a little bit of guidance, and their intelligence and common sense will see them through.
And I think that is 100% correct. And frankly, you can see there are very few countries that have been as totally like what I'm saying, but there are some. And I'll give you an example is Sweden, which of course has been inappropriately criticized, but I can go through that if you'd like. But the reality is they trusted their citizens.
Right.
And what they said was, these are the guidelines. We're not going to do a total lockdown. We believe you understand the seriousness of this. And people did social distancing and people did a variety of maneuvers. But on the other end of this, they're coming out in a much less harmed fashion. They didn't close their schools. They didn't lock down their businesses. They're going to take a hit because people did social distance. But what we've done here is really, it's going to take many, many years to recover from this. It's going to be a very difficult task.
Scott, COVID-19 and recent events in the news. Take a look at two tweets. Let's contrast two recent tweets if we can. Tweet number one, Mayor Bill de Blasio of New York City on April 28th. My message to the Jewish community and all communities is this simple. The time for warnings has passed. I've instructed the NYPD to proceed immediately to summons or even arrest those who gather in large groups. Tweet number two. Once again, Mayor de Blasio, this time on June 14, marching during today's East Harlem pray and protest, I felt confidence that change will come. And there he is, he's posted himself, pictures of himself in large groups. Okay, what are we to make of this?
Well, what we're to make is, this is what you see when you have irrational people in our leadership positions. I mean, because there's no logic, of course, to what you just showed, having that total disconnect. But even more so, even if you just took the first tweet, which was it's all about saving lives and stopping the infection, period, is what he said. The reality was it wasn't about that, because there was no evidence that you had to close all religious services and selectively open up other groups and other businesses. That's just not the way the data was. Even the WHO recommended various other ways to deal with small spaces. And so, I mean, I just think this was, again, fear and ignorance driving public policy. The contradiction is sort of just such underscoring the lack of rational thought when he's out and other leaders were out. Meantime, they keep saying it's all about lives, but they didn't lock down the nursing homes. And we had thousands of people in New York killed, not just died in nursing homes, killed by an order that commanded that infected nursing home patients were still going to be put back into the nursing home. So these are people that have really indefensible cases. And one day I hope that there's some accountability with that.
Another set of two items. These are not contrasts, these are similar. The contrast is that they're on other opposite sides of the country. Venice Beach, in Venice Beach, California, a picture of a bulldozer that's filling a skateboard park with sand on the beach to make sure that kids don't use it. And here's another picture. This one is in New York City. This is at the behest of Mayor de Blasio. City workers are welding shut the gates of a public park. Dr. Atlas, what do you make of Venice Beach and the park being shut in New York?
Yeah, well, there's two just really inexplicable thought processes going on there. One is that somehow people seem to think that in leadership positions that it makes sense to be confined indoors rather than be out of doors. That you don't have to be a doctor to understand that that is just completely ludicrous. And then when you look at the data, even the original data out of Japan, they showed that the transmission rates were far higher, by order of magnitude higher, inside, in confined spaces. Outdoors is far, far lower risk to get a contagious disease. This is just common sense. I don't even know how to explain how that is so ridiculous. But the second part is locking children's playgrounds. Again, we go back to the fact these are people, these leaders insist that, quote, it's all about the science, but they're doing things that are contrary to the science because there is virtually no risk to the people who would use those playgrounds. The children have almost no risk. In fact, I'll give you a quote from the JAMA Pediatrics Journal.
JAMA is the
Journal of the AMA
You.
Pediatrics. It's a special pediatrics journal.
Thank you.
Their quote is, this was a series of 48 pediatric hospitals in North America. And their quote is, the risk of a serious illness from seasonal influenza in children is, quote, far greater than the risk of serious illness from COVID-19 in children. So, I mean, this is a completely irrational response. To lock down the playgrounds is just, I mean, it defies any science whatsoever. And in fact, it just shows a complete lack of capability for being in a leadership position.
Last questions.